For more on healthcare around the world, we are joined by Victor Rodwin, a professor of health policy and management at the Wagner School at New York University. Professor Rodwin often writes about healthcare in other countries. Welcome to World Focus.
Thank you very much.
How is the US healthcare debate being perceived overseas? Do people in the rest of the world understand why it is provoking such strong reaction here?
I think people are perplexed. They don't understand this notion of government-run healthcare from the point of view of our debate, not least death panels, and the notion that government bureaucrats would be making clinical decisions. I think they don't understand it in Britain, and I know more about this, they don't understand it in France. I spoke with a journalist from Le Monde last night. They love Obama. They thought he was going to do great change, and they don't understand this popular reaction against the health plan based on a notion of a government takeover.
What does the term then socialized medicine mean to a European?
Socialized medicine means medicine both financed and provided by the state with the outlaw of any private sector whatsoever. There are very few cases of socialized medicine in the world today. Certainly, even in Britain, which has a national health service, that is not socialized medicine because you have a private sector, you have a supplementary private insurance sector, and you have extraordinary clinical autonomy. In France, even less than in Britain, you have nothing resembling socialized medicine. You have national health insurance, which is just like Medicare for all. Medicare in the United States is not socialized medicine. Medicare in the United States is public financing with private provision.
So could any of these countries that you've been describing be used as a model for the healthcare system in the United States?
France represents an interesting model because there is a large private sector, there is a tradition of rugged individualism. At the same time, there's a tradition of social solidarity, so that everyone is covered under a universal health insurance plan, and yet the provision is largely an office-based private fee-for-service practice, something we know well in the United States. In France, they regard our group practices, our HMOs, as something resembling more socialized kinds of medicine. But one has to remember that under national health insurance systems, the physicians are fiercely autonomous and fiercely independent and value their individual relationships with their patients. Clinical decisions are not made by the state, neither in Britain, nor in France, nor in the United States under the Medicare program.
Okay, Victor Rodwin, thank you very much for joining us.
Thank you very much.